It's very important for patients to know their individual risk. When you go to the doctor, you need to know your family history. You need to know whether you're diabetic or not. You need to know your blood pressure numbers, and you need to know your ideal body weight. The individual risk is what plays the most into how we decide whether a person needs a statin, and if they do need a statin, what dose of that statin to use. Statins are used to decrease lifetime risk of cardiovascular events. It's usually taken for a long period of time. It's not like an antibiotic where you take it for a couple of weeks, you get rid of an infection, and then you're done with that medication. The enzyme that they work on is most active at night when we sleep. So if you take a statin at night, that's when it has its highest efficacy. Statins are typically dosed as a daily pill, depending on a person's risk factor profile. That's how we decide what dose of a statin to use. In patients that are lower risk, those are patients where we will typically start with a low dose of a statin. In patients that either cannot tolerate a statin, or in patients in whom, even despite a high dose of statins, they still need to lower their cholesterol further to decrease their risk of cardiac events, there are newer medications called PCSK9 inhibitors. They're actually given by injection rather than in the form of a pill, and they are injections that are given every few weeks, depending on which type you use. Millions and millions of patients take statins and you would never know. And the reason why is because they are generally so well tolerated. You're not going to run into any major side effects, and if you do, you can always talk to your doctor about it and things can be adjusted.